However, the patient rejected the orthoses because they didn't feel exactly the same as the old UCBLs. All right, so we're going to talk about one of my patients, not actually pediatric, but adult patient who has diplegic cerebral palsy, so it affects their lower extremities more than their upper limbs. And this particular patient had used bilateral UCBL orthoses. It's a high profile type of foot orthotic. Used their current UCBLs for about 10 years. There's been a lot of stress to it, and I was worried about them imminently failing. And so I saw this patient for new UCBLs just due to wear of the old orthoses. However, the patient rejected the orthoses because they didn't feel exactly the same as the old UCBLs. So we're running into this problem where a patient who has used orthoses for a long, long time wants to find that feel of the old orthoses that fit well, that worked well, that were just worn out. We couldn't do traditional manufacturing again because we weren't going to be able to get exactly the same carbon copy of her current orthoses. So what we wanted to do was we wanted to copy the orthoses that she already had and fabricate those. So basically she's going in from one shape into the next orthosis that's exactly the same shape. So pretty smooth transition is what we were trying to hit on. So instead, we went to a hybrid workflow. And so this was our novel use of the 3D printing technology. For this patient in particular, we are able to reduce our fitting time from the typical of 1 hour down to 15 minutes because it's the exact same shape of their old orthoses. Basically, the patient put them on, we put them in their shoes, they walked around, and we're like, I'm out of here, see you later. So the patient was able to confirm the comfort of these orthoses matched the old orthoses, and now this patient has been wearing these orthoses every day for over the last 15 months. We were able to build that relief right into the new orthosis, and it was the easiest fit of my life as a clinician.